Hey, hello. My name is Julie. I am a first year student in the master's program at Arkansas State University. I'll be doing your exam today. How are you doing?
I'm well, thank
Okay,
you.
good. All right, wash my hands, gonna don my appropriate PPE. So we're gonna go ahead and jump into it. And first I need to do a room exam. So you can see, just have some various exam supplies, her exam supplies, bare table, and then let you see my cue card. Okay. All right, so we're just gonna go ahead and start with our cranial nerves. I'm gonna try my best to get me in here. And so first we're gonna start with our olfactory. And so I'm gonna ask you to smell two things and tell me what you smell. And so this is cranial nerve number 1, olfactory. Garlic? Perfect. And
Cinnamon.
okay, perfect. And so for cranial nerve number 2, this is our optic. So we are going to do our Snellen chart exam. We have one on the wall here, and that's for 20 feet. So I'm going to have the patient come here and stand at 20 feet, which is right there. She does use glasses, so there she is. And I'll be standing over here by the Snellen chart. And so, gonna just close your left eye for me. And can you read this?
EFPETOZLPECFD FELOPZD DEFPOTEC. Okay.
That's it. Okay, 20/20 for the right eye. Now go ahead and close and do the left eye.
EFPTOZLPED PECFD EDFCZP FELOPZD DEFZOTEC. I cannot read the last one.
So the most correct was the 20/25 for the left eye, and then we're gonna do both eyes.
EFPTOZLPED PECFD, sorry, misspoke. EDFCZP FELOPZD DEFPOTEC LEFOD. That's
Okay.
not a 7.
So bilaterally, 20/20. Okay, perfect. Now go ahead and come back for me. Alrighty. And so we are going to continue on with our cranial nerves. So we test our 3rd, 4th, and 6th together. So that's going to be our ocular motor, our trochlear, and our abducens. So we're going to do this with our cardinal gaze. So follow my finger. Okay, perfect. And we're going to do our convergence. Okay, perfect. And we're going to move on to our cranial nerve number 5, which is our trigeminal. And so what we'll have to do, I'm just going to position y'all. So what we're going to have to do is for our trigeminal, so for our sensory, just have the patient close her eyes and ask, can you feel just various areas?
Yes.
Okay.
Yes. Yes.
Okay.
Yes.
And then what we're also going to do is test for that temporal and emaciator. So go ahead and push down with your teeth. Perfect. And here. Perfect. Okay. And so for cranial nerve number 7, we have our facial. And so what I'm going to have you do is raise your eyebrows for me. Okay. And frown for me. Show your teeth. Puff out your cheeks. Perfect. And for 8, we have our acoustic. So I'm going to stand behind you and do a whisper test. Tell me what you hear, okay? It's a 2-syllable word. Taco. Perfect. Okay. And now we're going to try in this ear. And so we have
apple.
Perfect. Okay, great. And so then we're going to test our cranial nerves 9 and 10, which is our, we have our glossopharyngeal, and we have our vagus. And so what we're going to do is have the patient say ah, and we're going to look for that soft palate to rise. Ah. Okay, perfect. Soft palate rose. And then we also will have our gag reflex. And so we won't elicit that, but you would use a tongue blade and let your patient know that it's going to be uncomfortable and elicit that gag reflex. And so for cranial nerve number 11, we have our spinal process. Go ahead and raise up against resistance. Perfect. And look right to me. Right and left with resistance intact. And then for our last one, we have our glossopharyngeal. So go ahead and stick your tongue out for me for cranial nerve 12. Good. And can you lift it? Perfect. Awesome. All right. So we're going to go ahead and just jump right into that musculoskeletal. So can you go ahead and stand up for me and stand here and turn around for me just so I can get you on camera. All right. And so we are inspecting our patient. We're looking for the way the head sits on the shoulders, looking for that equal shoulder height. We're looking also at the iliac crest. We're making sure that it's equal as well. You want to note any lordosis, kyphosis. You want to look for any abnormalities, any swelling, nodules, tenderness. Ask the patient, are you tender?
No.
Okay. And then we can palpate, make sure that muscle is nice and even down the spine. And then we would go down. You're going to palpate that cervical fascia. So then you tuck your chin to your right. And then palpate here. Make sure everything's nice and even. There's no tenderness. And then also go down here to her spinal process. Palpate down that. And you also want to note from C7 to that gluteal crest if she's having any abnormal scoliosis, curvature. Everything seems nice and midline. And have the patient lean forward for a little bit. And then also just running down, okay, no lordosis, kyphosis, scoliosis. And then also we can do our range of motion as well. So just turn towards me. And can you do your flexion, extension, and then rotation, and then lateral. Okay. And same thing with our spine. So can you lean forward, flexion, and then extension, and then we have our lateral, and then we have our rotation. Okay, very good. And so go ahead and have a seat for me, and I'm just going to inspect the upper and lower extremities. We're looking for any abnormalities. We're looking for any swelling, nodules, masses, lesions, noting the temperature, color, looking at that wrist and hands, noting for any atrophy as well. And while you're assessing the patient, you're also looking at her face. You're noting symmetrical, any tics, and then also you can look to make sure she's not having any tremors, making sure everything's nice and symmetric, no nodules, no abnormalities, and make sure you're going down to her legs here. You want to be sure that her thighs are nice and even. There's no atrophy. Palpate her knees. Make sure there's no nodules or tenderness. Go down to her calf. It's nice and symmetric and even. Go down to her ankles. Make sure there's no tenderness or any bony prominences. So also while you're palpating, you're looking for the bony prominences. Any abnormalities in the anatomy, any type of abnormal tendons, bones, lesions, or anything like that, that's going to show up on the patient's arms, legs, noting any edema, anything like that, or any discomfort. And then just also looking for any fogginess too, when we are palpating. And then so now we can go ahead and test our range of motion. So we can do our shoulders first. So we can do raise forward, so our flexion, and then our extension, and then we have our abduction, and then our adduction, and then we can also do our bend your elbows at 90 degrees. We can have our internal and external rotation down. Perfect. And then also for our elbows, so flexion, extension, and then we have our ulnar and radial, internal, external rotation. And then we have our wrist range of motion. So go ahead and have your hands out. We're going to do our flexion, extension, and then our inversion and exversion rotation. Perfect. And then we're going to go ahead and do our fingers. So we're going to do flexion, extension, and then adduction, abduction. Perfect. And then we're going to have our thumb. So we're going to do our flexion, extension, flexion, extension, abduction, adduction, and then our opposition. Okay, perfect. Now I'm also going to test that thumb strength there. So can you, right there, and the hook here. Perfect, nice and strong. Perfect, nice and strong there. All right, thank you so much. And I can go ahead and we can, now that you're sitting as well, we can look at our rapid motion. So on the top of your thighs, just flop your hand like that as fast as you can on both. Okay, perfect. We'll do our point to point. So touch my finger with your finger and to your nose. Okay, perfect. And can you do your other finger, please? Perfect. Okay, great. And so for your feet, I'm going to just put my hands underneath your feet here and tap, tap, tap as fast as you can. Perfect. Okay, now do your heel to your shin and run it up. And we're looking for that coordination. We're looking for any ataxia that would indicate any cerebellar infarcts or any difficulties or any injury to that balance coordination area. All right, and now I'm going to test your strength. So what I'm going to have you do is, can you have your hands like this and push up against me, like, okay, and pull towards you. Okay, nice and strong. And we're going to do your wrists, so have your arms straight out for me, and then try to press them down and up. Okay, nice and strong. And then can you press up with your, all right, good, and down. All right, the same thing with the bottom down here, so go ahead and out and in. Perfect. And can you press down on gas pedals? Pull up. Okay, she's a nice and 5 in all strength areas. And so then I'm going to go ahead and just get that passive range of motion. So I'm going to hold her arm here and just rotate that shoulder and that elbow and that wrist and looking at the fingers. I note no resistance. Good passive range of motion. So do that shoulder, that elbow, that wrist, and those fingers. Very good. Okay. And then I'm going to have you, let's see, strength. Okay. And with your hips also do your, can you pull out for me for your adduction and then adduction? So abduction is out, abduction is in. Okay, very good. And I'm going to pull this. Can you stand up for me? Okay, so what I'm going to have you do is, can you walk for me? Just normal walking. Okay, perfect. And then can you tandem walk from heel to toe, like this? Very good. Can you walk on your heels? Good. Can you walk on your toes? Okay, very good. Can you hop in place for me? Okay, very good. Go ahead and have a seat for me. Thank you so much. All right. Now I'm going to go ahead and test her sensory with sharp and dull. So I have a, that's going to be our dull, and this is going to be our sharp. So you're going to have her close her eyes and tell me if you feel sharp or dull. Sharp. Okay. Dull. Sharp. Dull. 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 Sharp. Sorry. That's like dull. Right. Sharp. Okay, very good. Sensory intact. All right. And I'm going to go ahead and do your reflexes, okay? And so I'm going to start with that brachial. Make sure this is brachial. So I'm going to have her kind of rotate her arm out here. Find that tendon right here. And I'm going to strike my thumb. Okay. I could feel that tendon reacting with touch, but she didn't have much physical reaction. I'd say she's probably about a 1+. Okay, that's a 2+ on that side. And that's for our brachial. And this is our tricep, so just dead weight for me. And hitting right here at that tendon. Sorry. Okay. There we go. 2 plus over here. Sometimes it is a bit tricky getting that area. Just have your patient fully supported. And 2 plus in that area as well. And then we're going to do our patellar right under here, under that kneecap. And so I could feel her leg jump. There we go. 2 plus there. I would actually say 3 plus. She's very hyper-reflexic there. Okay, 3 plus. And then also, gonna do the Achilles area as well. And so just gonna kind of dorsiflex your foot and hit that Achilles. And really, like if they were laying in bed, you'll be looking for clonus, kind of vibration of that foot, especially in children. Then we're also going to do her bottom of her feet here. So I'm just going to remove her shoes for her. And then I'm just going to run this. This is like our Babinski. Perfect. And her toes go up there. Okay, very good. I know. I'm sorry. And so just be sure that your patient is aware of that and how they can have some tickle with that. And then we can go into our, okay, just checking here. Can you go ahead and stand up for me one more time? And face me and close your eyes. Just checking her stance, the Rumberg. She's not having any swaying here. And then also we're going to check for that pronator. So palms up and close your eyes. And then we would stand here for 20 to 30 seconds, but just for time. I'm not going to hold it the entire time, but you're looking for that pronator drift where those palms go down there. And so no drift, no Rumberts. Go ahead and have a seat for me. And then we're going to go straight into the abdomen. And I'm going to stand on her right side. So I'm going to put this right there. I'm going to support her feet down here. I'm going to move this over. All right. And just have your patient expose their abdomen. You want to be sure that she's comfortable, drape appropriately, explain the procedure. So first you're inspecting for any masses, bulging, pulsations, any gurgling, any abnormal lesions, nodules. Striae, gonna look at the size of the belly, so she's nice and flat. She does have some striae noted from previous childbirth, and want to assess for any abdominal discomfort, and then we can go ahead and auscultate. And you'll do clockwise, starting at the right lower quadrant and towards the midline. Okay, you would want to listen to 5 minutes, but just for the sake of the exam and the film, I did hear bowel sounds, normal active. Hyperactive would be greater than 35, and hypo would be less than 5 bowel sounds during that time period. And so then we want to percuss her abdomen using our finger here, hyperflexed, and we're just going to percuss here. We're looking for any hyperresonance or any dullness, and then also if this elicits any discomfort. Okay, and then gonna palpate, percuss for that liver span. So we're gonna start up here and work our way down for our dullness for that liver, and then start down here and work our way up to get that liver span. And her liver span is 6 centimeters mid-clavicular line. And then also we're going to percuss for the spleen. And so we want to do our anterior axillary line here. And you want to check for any dullness, which would indicate splenomegaly. And then you can also have the patient rotate their hips towards you on this side to kind of expose that and bring that spleen down, and take a deep breath in for me. Okay. She's nice and tympany. I'm not assessing any splenomegaly. So go ahead and just lay back flat for me. And I'm going to go ahead and lightly palpate her abdomen, looking for any masses, tenderness, lesions. Let me know if this elicits any discomfort for you. Okay. And then I'm going to go in with that deep palpation with that bimanual technique, about 2 to 3 inches. No bulges, no masses, no pulsations, no tenderness for her. And then I'm going to go ahead while I'm on this side, palpate for that spleen. So I'm going to just palpate here. You want to support her on this side. And you take a deep breath in for me. Okay. I'm not feeling any enlargement. She's also not saying that she's in any discomfort. I'm going to go ahead and come on this side and palpate for that liver. I'm going to support her over here. And then you want to press down and up and take a deep breath for me. Okay, good job. That didn't have any pain there. Okay. Just like a smooth edge there. When she breathed in, it did come to below about 1 centimeter. It's not nodular. It's not hard or fixed or anything like that. Okay, let me just check my cue card here. Okay. Now, just go ahead and sit up for me. And you can just relax if you want, because I'm going to move into the verbal exam. And so first what we have is with our one more thing that while she's sitting up before we move on is we're going to do that costovertebral angle palpation, flat hand and a fist there. And you want to ask if this elicits any discomfort?
No.
Okay. Any discomfort there? Okay, very good. Thank you so much. All right. So what I'm going to start with the male exam. And so what you would like to do is you want to start with your male penis here, and you want to first inspect. You want to look for any excoriations. You want to look for any masses, nodules, indurations. You want to look for any infestations, scabies, lice, any pubic masses, any drainage. Look for any blantus, any phimosis. Then we're going to check, and so you want to be sure that you're inspecting anterior, posterior, laterally, make sure everything, we're looking at that meatus, make sure that it's anatomically in the correct position. They're not having any issues or concerns. This patient is circumcised, but if they were uncircumcised, then you would want to retract that skin and look for any phimosis, make sure that there's no redness, tenderness, any lesions there, any signs of discomfort. Make sure that there's no drainage. And you would want to do your Tanner scale for your patient. So you would size the testes with the appropriate bead. And this patient is about a 15 there. And then you would want to go ahead and look at the glands and that meatus, scrotum. And then we can go ahead and start palpating. Palpate the penis and make sure that there's no tenderness, nodules, no fibrous tissues, not eliciting any pain. Pull back or retract that skin of the uncircumcised patient and go ahead and inspect. The scrotum, pull up, look down, size of the testes, the epididymis area, make sure the spermatic cord is nice and intact, have them cough, bear down. We're looking for any engulfment or any engorgement of that. And so everything is nice and intact with our patient. We want to also feel for the internal and external rings of the patient here, and you should be able to grasp that with your thumb and ring finger. Make sure that there's no type of things going on there, and also assess their angular nodes and checking for any type of hernias or anything like that. And we're going ahead and go into the female exam. You could do this in the lithotomy position. And so you'll have them laying. First, you're going to inspect the exterior of the vagina, and then you're going to open her up, and you're expect the labial minor and major, the mons pubis, and then the clitoris, the urethra, the vaginal opening. We're looking for any rashes, lesions, nodules, any discharge, anything coming from the female. And then, so you want to explain the procedure to her, make sure that she's nice and comfortable, and then we want to go ahead and go in with our speculum. And you want to go in with that downward angle and open up. So we're going to be inspecting that cervical awls area, which is right here. And we're noting for any nodules, discoloration, tenderness, and making sure that there's no discoloration, no growths. And while we were coming out, we're going to make sure that we're opening that speculum up and looking at the vaginal walls. And then we're going to do our bimanual. So we're going to have our 2 fingers inserted into the patient, and you're just going to palpate while you palpate down on their symphysis pubis area, and you're checking for any outpouching of that rectum. You're checking for any nodules, tenderness, and then you're also checking for any adnexia with tenderness on either side. And then we're going to move on to our rectal exam. So you want to be sure and ensure that you are letting the patient know the procedure. And so you will visualize the rectum, make sure that there's no tufts of hair, there's no hemorrhoids, there's no lesions, masses, drainage. And then you're going to go ahead and explain the procedure, have them bent over in the bent over position, take your lubricant, make sure that they're comfortable, don your gloves, and insert your fingers into the rectum and have them bear down. You're looking for the tone, tenderness. You're looking for any masses, lesions, anything like that, abscesses. You're going to go ahead and start and do clockwise and counterclockwise of that rectal exam. And just be sure that you're not noting any abnormalities, any irregulatory, sorry, tongue-tied. And then you also palpate the prostate on the male, and be sure that it's nice, mobile, non-tender. It should feel rubbery, not nodular. And the patient may have the urge to urinate, so let them know that. And as you're coming out with your gloved finger, test for occult stool. And also, I do want to mention also, whenever you're in there with that speculum, with that cervical awls, and looking at it, get your sample for your pap smear first, and then do any additional testing such as wet prep, KOH, gonorrhea, chlamydia, anything like that. Let me just view my cue card one more time. Okay, I think that is it. Thank you guys so much, and thank you to my patient. All right.